welcome back to my channel. As promised, guys, I'm here today to talk about the breast cancer awareness. It is the month of October and it's a month of breast cancer awareness, a month to create awareness for breast cancer. So I'm here today with my beautiful colleagues. This is Dr.
Fatima
and
Farida,
and I am your host, Dr. Obakam. You already know me, CocoD. So today we're going to be talking about breast cancer, what breast cancer is, who is at risk of breast cancer, how you can reduce the risk of breast cancer, how you could find out if you have breast cancer, because early detection is key. So we're just going to be talking about all of that, just basic stuff that you need to know, I need to know, and I feel like everybody should use their voice one way or another to create awareness for breast cancer, because you can never create too much awareness. So yeah, without further ado, let's just get right into the video. Stay tuned. What is breast cancer? Breast cancer is basically a life-threatening cancer that happens in women. Now, breast cancer can happen in men as well. However, it is rare. In the case of men, it tends to be more hormone positive. So that means that they grow slower. So by the time they discover it in men, it's already at an advanced stage. However, in women, it's something that early detection is usually, I think, is more. You could detect it earlier in women. I just shed a little bit of light on what breast cancer is. The next thing now is to talk about the risk factors of breast cancer. What are the risk factors of breast cancer?
Okay, so for the risk factors of breast cancer, we have plenty of risk factors, but we could divide them into the modifiable ones and the non-modifiable ones. Modifiable meaning like there are risk factors that you can change, like you can work on to prevent your risk of getting breast cancer. However, the non-modifiable are some things that we can't do anything about. Now, for the non-modifiable ones, we have our age. Increasing age increases your risk of breast cancer. Apart from that, we have family history. Like if you have a family history of cancer, if somebody in your family has had cancer before, maybe your mom, your auntie, or something like that, the chances of you getting breast cancer are a bit higher than somebody whose family member doesn't have cancer or something. Apart from that, there's some genes that some mutation or some kind of genes that could increase your risk of getting breast cancer.
I think being a woman as well, the mere fact that you're a woman as well just already predisposes you to it. And okay, you said the non-modifiable are the ones you can't really do anything about. So that also includes people who see their menses less than 12 years of age. It's not a crime that you saw your menses that early, but you should know that you are at risk of breast cancer if you fall within that category. People who also have their menopause at a later age. I think menopause is supposed to be around what age?
From 45, right?
Yeah, to 50. I think anything more than that, 60, I don't think is a good sign. That's like late menopause.
So what we're saying is that if you fall within that category, then you need to be more vigilant. The truth is that for breast cancer, everyone has to be vigilant. Everyone has to be aware. You have to take your breast exams seriously. If you're in the age for screening, you have to take your screening seriously. But if you know that you have these risk factors, then you take extra care and you make sure that you're familiar with your breasts.
Then apart from that, there's the nulliparity, which is women who haven't given birth. Women who haven't given birth are at increased risk of breast cancer. Women who give birth early in life have a reduced risk of breast cancer compared to women who start giving birth at in their 40s or something. Not like it's your fault or anything, but it's just an increased risk of getting breast cancer.
Now we've just thrown light on the risk factors: age, being a woman, not eating right, early menses, late menopause, smoking, alcohol, all these things that we might see as nothing. It's something. So now we're just going to talk about, if you fall in that category, how can you reduce your risk? Because there's supposed to be help, which is what we're here to talk about. So you don't just feel like, okay, since I'm in this thing or I'm in this category, that's it, my own is finished. No, it's not like that. There are ways you can actually help yourself. So that's what we're going to talk about now. So I think being a woman, it is advisable, because you're already at risk. You have a breast, you're already at risk. You have the hormones that promotes these cancers. So breastfeeding, you should take breastfeeding very important. Some people just feel like, no, I don't want to breastfeed for too long, or it's like it's not just for the baby's own good, it's for your own good as well.
Exactly.
Like you should try to do exclusive breastfeeding at least to 6 years. Some people even do up to 2 years.
6 months.
6 months. From 6 months to 12 months. Some people even do up to 2 years, and that's still okay.
Yeah.
You know, yeah.
Then for the breastfeeding also, I just want to add that everybody should aim to breastfeed exclusively for 6 months, unless you have a health condition that prevents you from doing that.
Yeah. So is there any example of any health condition
Like
that can prevent?
HIV, AIDS?
Yes, because okay, let me just give a little story. Actually, there was this patient when I was doing pediatric posting. There was this patient, a little boy, was about 10, 11 years old. He was actually my first patient in pediatrics department. The first day I arrived, he was my patient. This guy, when they brought him to the hospital, he was bleeding from his eyes, his nose, everywhere. They thought he had viral hemorrhagic fever, you know. So everybody he was already in the isolation ward. So it turned out that this boy had been HIV positive all his life, and nobody knew about it. His kidneys had shut down, his body was basically shutting down, and other hospitals were sending him away, thinking he had. I think it was during that Lassa fever period.
Yeah.
So it was really sad because his parents were aware that they were HIV positive. They were not on medications. They didn't take precautions after he was born. You know, they just let him be, him and his sister. So they're both carriers. They both have HIV. So it was very, very sad. So I feel like you should knowing your status is another thing. Like we always talk about know your status. It's also coming in here to play as well. Because as a woman, if you do not know your status, then you wouldn't know that you have HIV.
You stand the risk of passing it
to your child. Yeah, so you have to know your status. When you go to the hospital to get booked for your pregnancy, they tell you do this test. Don't complain and nag. I know the money can be much, but it's for your good and the good of your child as well. You can imagine how much sadness that boy's mom feels.
I think basically behind every awareness campaign, even what we're doing right now, we're trying to remind you, to teach you that you can't be passive about your own health. You can't be passive about your body. We should know. You should be aware of everything. Be vigilant about everything that goes on in your body. It's just that one body, that one life to live. So you have to take care of it as best as you can. Don't ignore the signs that your body tells you. Don't refuse to go to the hospital. Don't refuse to listen to your doctors. You have
to take tests. Don't be scared to take tests. It's not a dead sentence. There's always help somehow.
It's always
one way or
better
another.
to know.
And it's better to know early. So and then how about the age? How to reduce it with the age?
Well, before we talk about that, I have to plug this in. I don't want any young ladies seeing this video and thinking, breast cancer is something for older women. No, you're not too young. You're not too much of a baby girl. When I was doing my surgery posting, the most striking thing to me, surprising even because I did not expect it, a lot of the women on the wards with breast cancer were so young, 20s, 30s, and then they had really advanced cases because it's not something they were looking out for, perhaps. So, you don't, in your 20s, you don't think,
you don't want to think of that.
You don't want to think like that.
Old women. Why time to think about that?
But we're saying that you should, please, you should. We'll talk about examinations and screenings later, of course, but I should just plug it in that you should be familiar with your breasts, what it feels like before your period, during your period, after your period, on a normal day. Do your exams, girl. Be familiar.
Yeah, be familiar with your body. Touch your breast. It's not a crime to touch your breast.
It's nothing to be ashamed of.
Yes, when touching that normal, you will know.
Yeah.
So with the age though, teenagers don't, tend to have that. But women as young as 25 years and above, like she said, a lot of women in their 20s. So it's something that is no longer for our mother's generation anymore. It's now here. It's with us because all of us here are in our 20s. So so now we're just going to shed light on the signs and symptoms of breast cancer. Like she already said, you have to know your breast before you even begin to know the signs and symptoms. Know what your breast feels like before period, during period, after period. And then if you notice these changes, then you raise alarm.
Any of these changes, change in color, change in the texture of the overlying skin. If you notice any discharge from your nipples, by the way, we'll put a link to how you can do a breast exam. So you'll follow the steps
in the description below.
So any discharge that is not breast milk, blood, any type of fluid, any lump, whether this is in your breast or in your armpits, any pain that feels abnormal, you know, any redness, change in the shape, inversion, a retracting of your nipples, you know, and anything at all that feels odd to you, because we're assuming that you're going to take your exam seriously now, and then you know what your breast will be like. See, you had rather go to the hospital and get an exam there and they tell you it's nothing than to sit down and it will be something else. Like, and that's what you should know.
And then one other symptom that people might overlook, you see something like eczema or something like around your areola, don't ignore it. Please go to the hospital.
Yeah, the areola, for those who do not know, the areola is basically that dark part where the nipple latches onto. So that's the areola. Orange peel is the key word. If you just have an orange and if you think your boobs look like that, there's a problem. Please talk to your doctor immediately.
Yes. Yes. Emphasis on immediately.
Yes,
if you feel there's anything wrong, immediately just go.
Okay, so we've spoken about the signs, the symptoms, everything. Now we're going to talk about the examination, self-examination, and any other examination that is required.
Okay, so it's advised that at least from your 20s, I'll say 18 really, but at least from your 20s, you should have a breast self-exam periodically. So that's the one that you do yourself, which we're going to let you know how you do that, just so you're familiar and you can tell if there's anything wrong. So periodically can be maybe you do before, after your period, and then from 20 to 39, then you can get a self-exam by a healthcare professional. So maybe this can be like during your checkup once every 3 years, right? You can get that just so you have someone telling you that everything is okay. Then from your 40s, you get a mammogram annually. Now, if you're younger and your doctor feels you need to get a screening, maybe they find that there's something wrong, then you get an ultrasound. Because younger women typically have denser breasts, so that's what you'll be asked to do.
Okay.
Yeah, so I think that's
an ultrasound is safer for younger women. Yeah, so women less than 40, basically.
Yeah.
Okay.
So I think that's it. Like, what we're trying to tell you basically is just that you should be vigilant. At the end of the day, all these tests and what they mean should be left for us. Yeah. But you should know.
Because early detection is usually
because key. No one knows your
early detection is key. It's key. It is key. It's key. And you can't. The doctor will not come to your house to detect it for you.
You have to be
the one to. Yes. Feel, touch,
so look
your
at it and look at it. It's not just about touching. Look at it, so that when one is bigger than the other or something, you would know.
Yeah, true. But I think naturally,
one is usually bigger than the other. But when it's abnormally bigger than the other,
that's the point of getting familiar. You already know which one is bigger.
So once you've known your boobs and what they feel like, what they look like, there's some investigations that your doctors might send you to do. When they send you to do it, please don't argue. I think it's expensive though.
Don't run away.
What part of the world?
Don't run away. Don't run away.
So I've had so many patients. They will come to us. We tell them, just go and do this. Don't
run away. You can't cheat your
It's your health. It's your health.
Well, for biopsy, we never saw her again. I keep on wondering, like.
No, but I can understand some people.
Yeah,
some people do not. When they tell you they do not have it.
Yeah.
You see, even 2K that you use for your data, some people have not seen it in a month. It's really sad. So I feel like if anybody who watches this video, actually, if you're an NGO or somebody who has connections, I feel something should be done. I don't know if maybe there is.
Yeah, actually,
a special lab should
this
be.
month. You should take advantage of this month because there are a lot of free screenings and screenings at a discount going on. Like, we should leave the link to all that. Different states here in Abuja. So please just we'll put all the ones you can find, but try to find one around you. And
anyone I'll try to research. Please help me check as well. So I'll just leave everything in the description bar below, so you could find it if you're in Abuja, if you're in Lagos, wherever we can find.
You have to do a screening test. Just
that's about it, guys. In summary, what we have spoken about is breast cancer. Okay, it is real. It is life-threatening. It can happen to anybody. When I tell you anybody, I mean anybody. Young babes, Sisieko, grandma, it can happen to anybody. So long as you're a woman, that's your #1 risk factor of breast cancer. So try to do these things we've told you to reduce your risk. Breastfeed your babies. Breastfeed your babies. Some stupid people will say breastfeed your husband. I don't know. what's wrong with you? I'm not talking about that one. Breastfeed your babies, please. And then avoid, you know, too much junk. I eat junk a lot too. Try to avoid it.
And
Try to avoid
reduce your alcohol intake.
exercise.
Reduce smoking.
I'm hitting the
exercise
gym
well.
soon.
Reduce
Join
your
me.
fatty foods intake. You know,
Exactly.
just do everything in moderation.
Eat your vegetables, eat your fruits, like don't forget about them.
Yeah.
You know, my mom always tells me something. Even if you want to eat indomie morning, afternoon, and night, cut veggies and put in it.
Exactly.
You should make it a habit.
Yes,
Yeah.
remember to eat fruits. Like it's so easy to forget because for just
I forget to eat fruit
Yes,
a lot. I'm
no.
serious.
So
it's like
really,
I feel
that's
like I'm
what
being
you should
forced to eat fruit.
but you should like always have fruit at home,
At
so you
home.
can just
If you want to
Yes.
snack on something, it's
Yeah.
even like if you make it a habit of snacking on fruits. That'll be
Amazing.
awesome.
You're truly what you eat.
Yeah, you are what you eat.
So if you're watching this video, I think you should tell the babes around you, tell the women around you,
Tell them,
educate them, please.
Yep. Educate them. Create more awareness, please.
Yeah.
Let's
Let's
fight
talk
this
about
together.
it. It's not a taboo. It's not something to be ashamed
Yeah, so
about.
people
You
are
can
really
call
ashamed
your
of
friend
talking
up and
about
ask
it.
her if she
Like,
has
it's
done
like-
her breast exam.
As in-
It's not a big deal. Okay.
Don't be ashamed.
Anyways, I guess that's about it. Any
Yeah.
other thing to add?
Alright, so
Very
if
good.
they have any questions,
Yeah.
just
Yeah, if you have any questions,
We can do a
please.
part two.
Yeah. If you have any questions, please leave it in the comment section, and perhaps we'll do like a part 2 where we answer these questions. So thank you so much for watching this video. I hope you really enjoyed it, and I hope you gained something from this video today, which is the most important part, not just to see our fine faces. But yeah, thank you so much for watching this video. Please keep creating awareness for breast cancer. It is real and it can affect anybody. Okay, thank you so much for watching, and I'll see you guys in my next video. Do hit the like button, don't forget to leave your questions in the comment section, and subscribe, and I'll see you guys next time. Bye.